an introduction and the opportunity to be here. I'm honored to represent Byteflies, which is a Belgian company. And it's actually, today marks a day for us because it's the first time we actually present our virtual epilepsy care solution for such an expert and large audience. So happy to hear. Probably some of you know Byteflies and our wearable technology from clinical research projects such as CIT. But actually in the past year and a half, let's say, we actually transitioned. We made a shift towards clinical practice. So we took all those learnings from the valuable research, but brought it to reality. And together with the help of our partners, we launched EpiCare at home. We got it in the hands of everyday practice and neurologists. And what was most satisfying was to see the direct impact we made on people with epilepsy. So that will be my topic of the last session before you can go to the break. And let's see why we transitioned towards this practice rather sooner than later. Oh, sorry, one back. Oops. Can I go one back? Ah, yeah, of course, sorry. So let's see why we're doing this. And I think you all know, but people with epilepsy everybody has a personal story and a personal burden, but there's one thing they all have in common, and it's the not knowing that affects them every day. And this inspiring quote by Tori Robinson, she's actually a patient advocate in the UK, really stuck with me the first time I met her and when I came into this field of epilepsy. And it's a daily reminder for me, the team, and I think many of you, to do better, to support better care and get closer to the knowing, just like John was introducing as well, and many others here. So let's face it, again, we're not really doing a great job at the moment. If you look at the journey of a patient towards the right treatment, it remains too long and it's still very cumbersome. We all know the statistics, but what to me is the most striking thing is that there's no significant change in clinical outcomes, and costs are only doubling, despite the fact that there's, of course, big investments and new anti-epileptic drug coming to the market in the past decades. But this can be traced back to the fact that we lack real-world data and objective seizure counting. And as Dean already said, time is crucial, and especially outside the hospital as well. And it's our responsibility as a community to tackle this lack of information. And one solution is filling that gap in daily life. So imagine a world where remote patient monitoring is at your availability, where you can objectively assess seizure burden over time. If you look at the current patient journey, there's 1 or 2 spot checks at the hospital, very accurate, of course, but with the hope of capturing a seizure. And we know it's very unpredictable. So actually what needs to happen is there should be an augmentation. So it should be complemented with extra periods of remote patient monitoring to actually put a magnifying glass on a person's epileptic and physiological fingerprint in a real world setting, because that's usually where seizures are triggered and where a lot of information today is lost. And only then we can actually move from a treatment optimization perspective to these prolonged cycles of trying and all the suffering that comes with it towards a more evidence-based and a faster treatment optimization. So that's the concept that I try to visualize here. So with the Byteflies has the ambition or the vision to become a widespread, a worldwide enabler of virtual care. And for epilepsy specific, for EpiCare at home, we took into account also several product and service features to get this into the clinics, with always the neurologist or the expert in the loop. It all starts with a telemonitoring prescription by the neurologist for a specific patient with a use case. They don't have to worry about the logistics. That's taken care of by us as a company, as a service. And then the patient is remotely monitored at home during daily activities, and this can be up to 4 weeks period. And here we leverage really our Byteflies wearable technology. You can see in blue the little sensor dot, and the patient can wear this in a comfortable, discreet way, which not only includes the measurement of, reduced EEG channels behind the ear, but also ECG, heart rate, and motion. And this all simultaneously. So having that synchronous set of data measured at home, that real-world data is presented to the neurologist. But before we do that, we of course need to reduce the amount of time and already pre-process this valuable multimodal data set. And this happens in an annotator flow where annotators are assisted by algorithms, but they still skim through it. They flag potential epileptic events or other physiological parameters and provide these insights for several seizure types into the dashboard. And in the dashboard, at the end of the chain, data and insight are made available for the neurologist. This is both at the sample level, as well as vital signs that are derived like heart rate, respiration rate, and so on. Now, let's have a look at the end of this value chain and the impact such a tool can make when we give it into the hands of neurologists. So when we looked in our first preliminary analysis, a retrospective review, we found an impact of 75% on people with epilepsy. And that was very motivating to see in these cases where sometimes the patient was only measured for one period at home, not even multiple periods. And what do we mean with this positive direct clinical impact? Well, it meant that the data was sufficient to support a clinical decision by the neurologist. Examples are adjustment of treatment, starting of a treatment, a confirmation of a diagnosis, or a negative video EEG follow-up, and so on. But let me make it more tangible by looking at one case study. And this is an example story of an adult male with focal impaired awareness history who was seizure-free for many years, thanks to a triple therapy. But unfortunately, he was involved in a car accident. And the court, so from a legal point of view, it was requested what was his responsibility because he lost consciousness. And this secondly also led to the clinical question, is this patient becoming refractory? And due to a negative EEG, the neurologist decided to give EpiCare at home to do remote measurement to have quicker access to data and quicker insights. So we analyzed this data, found several relevant events, which are visible here if you look at the dashboard where everything comes together. So a particularly event that stood out, which was when the patient itself also marked something in his diary in yellow, was actually correlated with, if you look at the raw EEG, a focal EEG rhythmic pattern, also with some ictal increased activity and a drop in heart rate after the seizure. This was presented to multiple epileptologists and confirmed to be a clinical focal seizure. So based on these interesting results, from a legal point of view, this gave more clarity on the case and his involvement in the accident. But from a clinical point of view and more interesting towards his care pathway, he was referred to a video EEG reference center to find a better treatment. So with that, I want to conclude again the 75% of impact that we made, not only on adult people, but also some pediatric patients. Which was really satisfying. And I know it's in the early days, but it does show the ability that a solution or a service like EpiCare at home can deliver impact and inform clinical decisions in a more evidence-based way with multiple signals. So definitely reach out to us. I'm not here alone. Also, my colleagues Ben and Hans are here if you want to know more about the other patient stories, which are some are very heartbreaking. So I want to thank, of course, my colleagues, but also the people that helped us throughout the way in the past years, which is many partners, as you can see here. I definitely invite you to listen to the talk tomorrow of Lauren from UZ Leuven, who will go more deeper in the clinical validation of using our technology in a clinical study called SeizeIT. So with that, I think the future is bright if we embrace all these technologies that we heard today and focus on impact. So thank you.